Hello everyone. So in this video we will be talking about melasma, which is a fairly common condition and an important topic asked in dermatology. Melasma is an acquired hyperpigmentary disorder of the face which usually affects women. It is also called poto in Nepali. Let's start with the etiology. The most important etiological factor implicated is increased sunlight exposure due to the UV radiation. Another important factor is hormones. So estrogens is the most important hormone implicated in developing melasma. Melasma is more common during pregnancy, which is also called chloasma or mask of pregnancy. It is also common in patients taking birth control pills, which has estrogen as a component. It is also common in thyroid dysfunction and in patients taking certain drugs like phenytoin, and patient using certain cosmetic products, and women who use too much cosmetic products or use unauthorized cosmetic products without consulting dermatologist. So these are some etiological factors implicated. Talking about the epidemiology, it is more common in females, especially in the darkly pigmented ethnic groups, and the peak incidence is in 30 to 50 years. Talking about the pathogenesis, in melasma, the number as well as the activity of melanocytes is increased. So these melanocytes, they have certain units called melanosomes, and these melanosomes are actually the one that produce melanin. So increased number and activity of melanocytes causes increased number of melanosomes, thus producing excess melanin, and this melanin pigment is the one responsible for pigmentation of the skin. So it results excess melanin, it results in hyperpigmentation. Now talking about the clinical features, we can find hyperpigmented brown macules with well-defined scalloped margins. So these hyperpigmented brown macules are actually symmetrical, as we can see in this picture. The important differential diagnosis for melasma is malar rash, which is seen in lupus. So in lupus, the malar rash, it is also hyperpigmented and symmetrical, but the color is red, unlike melasma, which is brown. The most common sites involved are the cheeks, the nose, the forehead, and the chin. The hyperpigmentation, it darkens with sun exposure. Now let's talk about the course of melasma. So melasma is a potentially reversible condition, and it usually goes away after the discontinuation of the etiological agent, such that it fades away after pregnancy, it fades away with sun protection using SPFs, and it also fades away after the discontinuation of birth control pills. Now let's talk about the differential diagnosis of melasma. It includes post-inflammatory hyperpigmentation, freckles, so these are certain hyperpigmentary disorders, and another one is malar rash, as we already talked about it. Now let's talk about the management of melasma. So investigations are usually not required in melasma because it is a clinical diagnosis, it is a bedside diagnosis. Important is the treatment. So there are various treatment modalities available, but the most important one is photoprotection. So we should advise the patients to avoid sunlight at the peak. We can advise them to use hats or umbrella while walking out in the sun, and we should advise them to apply sunscreen with SPF 30 or more. SPF 50 is preferred, so we should advise them to apply it 3 times a day, usually at 8 a.m., 11 a.m. and 2 p.m. So it is easy for them to remember. Another modality includes the skin lightening agents. So they have a common mechanism, so they inhibit tyrosinase. So tyrosinase is an enzyme which is the rate limiting enzyme for the production of melanin. So if we inhibit tyrosinase, the melanin production is inhibited such that the pigmentation also reduces. So there are various agents available as skin lightening agents. So these include hydroquinone 2 to 4% topically, alone or in combination, azelaic acid 10 to 20%, kojic acid 1 to 4%, glycolic acid 6 to 12%. So there is a triple regimen available for melasma. So the triple regimen is usually applied to moderate to severe kind of melasma. For mild kind of melasma, only photoprotection and certain one of these skin lightening agents is enough. So this triple regimen, it includes fluocinolone, which is a steroid 0.01%, plus hydroquinone 4%, plus tretinoin 0.05%, which is usually applied before sleep and washed away the next morning. So if the melasma is very severe, chemical peels can be used. So these chemical peels are always applied under supervision of the dermatologist. So it includes glycolic acid 70% and trichloroacetic acid 15 to 30%. So this was about melasma. So we talked about what is melasma, the etiology, the epidemiology, the pathogenesis, the clinical feature, course, differential diagnosis, and the management of melasma. So for further information, you can refer to these books. And that is all for today. Thank you for watching the video, and I hope you learned something, and see you guys in the next one. Thank you.